The General Direction of Animal Health and Veterinary Medicines, HAVM, of the Italian Ministry of Health, in collaboration with the Istituto Zooprofilattico Sperimentale of Abruzzo and Molise, has developed a national information system for the management of the electronic prescriptions of veterinary medicines. The control of distribution and administration of veterinary medicines, along with the monitoring of antimicrobial resistance (AMR) in bacteria, are fundamental elements for the prevention of risks due to the emergence of pathogens resistant to certain antimicrobials and the presence of medicine residues in food of animal origin. In particular, the mechanisms beyond the emergence of bacteria strains resistant to specific antimicrobials are rather complicated and influenced by the interactions between these substances in humans, animals, and the presence of residues in the environment due to a non-prudent use of veterinary medicines. Only a well-organized information system may be able to promptly identify the health risks emerging along the food value chain and to provide the official veterinarians and public health officers with all information needed to put policy and actions into place for the correct use of veterinary medicines founded on effective and science-based monitoring. The information system is strictly linked with the other national veterinary databases, the national animal registers where all animals and farms are recorded, the food safety information systems which provide data on the quality and safety for food and animal origin, the handbook of veterinary medicines, and the national database for human medicines traceability. Thus, it allows to have a wide and comprehensive view on the distribution and use of veterinary medicines across the whole food production chain. This system is coherent with the national program of the Italian government on the simplification and digitalization of procedures within the public administrations, which foresees the implementation of innovative solutions to facilitate the daily work of the components of the national sanitary system and the respect of duties and obligations by the citizens through the so-called dematerialization of administrative acts. The electronic medicines prescription, therefore, is not just the mere transposition of paper prescription into a file, but it introduces a substantial change on the previous organizational model for the management of veterinary medicines through the complete digitalization of all procedures from the distribution to the use of veterinary medicines. A significant aspect of the new system is that it does not introduce new obligations or rules in respect to those already in force, but on the contrary, it simplifies and, where possible, reduces the burden for the farmers and professionals through the reuse of data already available and stored in other national information systems. The subjects involved who can have an access to this system are all those having a role along the process of distribution and administration of the veterinary medicines, and in particular, private veterinarians who register the date of the prescriptions using computers, tablets, or smartphones, even directly on the farm, indicating the medicines, the doses, the withdrawal periods if relevant, the duration of treatments, and the animals to be treated. At the end of the registration of prescription, the system sends a message to the farm's owner and keeper with the unique ID code of the prescription. The farmers, owners or keepers, who can go to the pharmacy or other shop authorized to sell veterinary medicines, carrying with them the unique ID code of the prescription received by text message, email, or on a mobile app. Wholesalers, authorized to sell at retail, pharmacists and feed business operators who have access to the system and visualize the prescription through the ID provided by the farmer. During the sale, they register the lot number and the expiry date for each medicine. In this way, the farmer register on medicine's use is automatically filled with the data on purchased products without additional work on behalf of the farmer. Once the animals have been treated, as prescribed by the veterinarian, the farmer completes the registration of the identification IDs of treated animals, the medicines used, the doses, the starting and ending dates of treatment, and the withdrawal periods. This procedure guides the farmer during the administration of medicines, reducing the mistakes on doses and animals to be treated. Through this procedure, the register on the medicine products kept on the farm is automatically updated as foreseen by the legislation in force. The main beneficiaries of data collected are the local and regional veterinary services and the Ministry of Health, who can have access to all aggregated and detailed data. The system provides them with a series of data analysis tools for monitoring the use of veterinary medicines and to facilitate the assessment of possible deriving risks. The integration with the national databases and the other veterinary information systems allows to evaluate the use of medicines along with the information on farm size and composition, animal movements, slaughtering, and the results of national control programs. In addition, the electronic management of treatments allows to automatically fill in all those forms foreseen by the legislation in force, as for example the section on food chain information foreseen by the Regulation EC number 853 of the 29th of April 2004 for animals intended to be slaughtered and included in the Declaration of Provenience and Destination Model 4 or the automatic compilation of vaccination certificates Model 12. In conclusion, the frequent detection of bacterial strains resistant to specific antimicrobials is an emergent problem and a priority for all health systems. The mechanisms of selection, growth, and spread of resistant bacteria are particularly complicated and influenced by the excessive and sometimes not proper use of antimicrobials in humans and animals, the exposure through the consumption of food and animal origin to residues of drugs used in animals, and the dissemination of these residues into the environment through the human and animal excreta. For these reasons, an information system able to monitor the distribution and use of antimicrobial medicines along the food value chain and to promptly identify the possible related risks represents a fundamental component of the whole health surveillance system and a valuable tool for decision-making in health sector.